Welcome back to Medical Associates Health Check. I am Dr. Laisha Selvaraja, the Head of Accident and Emergency and the Clinical Administrator for Medical Associates. And with me today, I have Dr. Ronan Ali, Interventional Cardiologist, back by popular demand. How are you doing?
Excellent.
Great. So as you know, this year we're doing things a little different. We actually get to spend some time looking at our patient's journey through the hospital. And if you remember correctly, we met Mr. Roger Cujo when he came in with chest pain. And unfortunately, he suffered a heart attack, but he did graciously allow us to talk about his experience and get to see how things went for him. So do you remember Roger?
Oh, yes, definitely.
So what we'll do is we'll just flip back to see how his journey through the hospital went, and then we'll talk about how he is now.
Good day, sir.
Hi, Dr. Ali.
Nice to meet you.
Gosh, nice to meet you as well. Please.
The emergency room team has asked me to see you because unfortunately it looks as though you're having a heart attack. And the type of heart attack that you're having looks like an artery is totally blocked off. The best treatment available for this is for us to do an emergency procedure. It's called a cardiac catheterization. And what this procedure entails is I put a little tube into the artery in the wrist, give you some numbing medication, and then through that tube, advance other tubes up to the heart, take pictures of the arteries using X-ray dye, find the artery that's blocked off, and open it up.
Okay, that's the extent of the intrusion?
Yes, that is the extent of the intrusion. We do everything through a small little incision in the wrist.
Okay, how long would it take?
The procedure itself takes about 15 minutes to take pictures.
Okay.
And depending on what I have to fix, it might be about another half an hour to 45 minutes.
Well, it's a lot shorter than I thought it would be. But what about the risks of the procedure itself?
The risks of the procedure are small. The risk of major complications, and by major complications I mean death, making the heart attack worse, risk of a stroke, less than 1 in 1,000. The risk of minor complications, bleeding at the procedure site or infection and so forth, less than 1%. The risk of doing nothing far outweighs the risk of the procedure.
I get that, for sure.
You willing to proceed?
Absolutely.
Okay. My cath lab team will be in shortly and we'll get things started.
Okay, great. Thank you.
You're very welcome.
AI technology is changing healthcare. And at Medical Associates, our new AI-powered MRI scans give you clearer images in half the time. And right now, you can get $800 off your MRI at our St. Joseph branch. So call us now to book at 662-2766, extensions 4072 or 4073. At Medical Associates, we make it easier to get the clarity you need with the care you deserve.
The first step in performing a cardiac catheterization procedure is to gain access to the arterial system. We have already gained access in the right radial artery, which will be our point of entry for performing the procedure. The next step is we advance a small plastic tube into our sheath, and through that we advance a wire up into the arterial system. It goes up through the radial, brachial, and subclavian arteries before lodging in the ascending aorta, which is the big blood vessel in the chest. Once the catheter is in place, the guide wire is removed from the catheter, which is then connected to a manifold system through which we will inject X-ray dye directly into the heart arteries. It is in fact the artery that caused the heart attack. there is a 95% blockage within the left anterior descending artery, which is the artery coming down the front wall of the heart. This artery will need to be fixed with an angioplasty and a stent procedure. Go ahead and prep for angioplasty. In order to proceed with our intervention, we need to exchange our diagnostic catheter for a guiding catheter. So we replace the wire into the catheter and then perform a catheter exchange. This will then allow us to insert our guiding catheter, which is required for us to perform our intervention. Once our guiding catheter is inserted, we remove the guide wire once more and connect our equipment, which will allow us to perform our intervention. The next step in performing our intervention is to introduce our coronary guide wire. This is a very tiny guide wire with a flexible tip, which I will now put a shape on. And once the tip has a shape, we introduce the tip into our guiding catheter. And up directly into the heart artery. The wire is then gently advanced beyond the blocked portion of the artery. And then the introducer is removed. In this case, with just the very thin wire advanced beyond the blockage, blood flow within the artery has totally shut down. So in this instance, we need to move quickly to restore blood flow. We will load a balloon catheter onto the wire and advance the balloon catheter up to the blocked portion of the artery and inflate it, restoring blood flow. Once the balloon catheter is appropriately positioned, we connect to an inflation device and inflate the balloon catheter. And with the balloon catheter inflated, once it is deflated, flow is restored in the artery. Once flow is restored, we can then remove the balloon catheter and prepare to insert our metal scaffold or stent. The stent is inserted using the same technique. Once it is advanced into the coronary artery, the stent is positioned across the blockage And once we are satisfied with the position, using the same technique, we deploy the stent in location. Once the stent is deployed, it does not move. Stent deployed at 12 atmospheres. The stent balloon is then removed. The stent having been deployed, we then take our closing pictures to ensure the stent is well opposed to the vessel walls. The stent does look well opposed. We will then remove our guide wire and take our final pictures. The artery has been successfully treated. At this point, the arterial sheath will be removed and the patient will be transferred to the cardiac care unit for intensive monitoring overnight.
At Medical Associates Oncology Unit, we know every cancer journey is unique and deeply personal. That's why our team of expert oncologists, nurses, and specialists are here to provide you with world-class care right here in Trinidad and Tobago. From early diagnosis to advanced treatment options, we offer cutting-edge technology and compassionate support every step of the way. We're here to guide you emotionally, mentally, and we understand how costly treatment can be. So, we have reduced our prices to assist you financially as well. Every aspect of your journey matters to us. With expertise you trust and care, you can feel Medical Associates, the Caribbean's #1 comprehensive and internationally accredited hospital.
Wow, so that was pretty intense.
It was, yes.
And so he had a stent put in. Tell me what happened to Roger, because we only really got to see the first parts of you advancing through. So tell us what happened after.
So the artery coming down the front wall of the heart, known as the left anterior descending, was almost totally blocked off.
Oh gosh, okay.
99% blocked.
Okay, so what did you do? How did you fix it?
So we advanced a little wire down past the blockage, and just advancing that wire actually completely shut down flow in the artery.
Oh,
That's
no.
how tightly blocked the artery was, yes.
Okay.
So we had to quickly advance a balloon
Yeah.
right where the blockage was. And when we inflated the balloon, that restored blood flow, stopped the heart attack. And then we deployed a stent, which is a little metal scaffold,
Yeah.
right where the blockage was to keep the artery from collapsing back down on itself.
Okay. And it was only one stent you had to put in.
One stent.
Lucky, thankfully. So after one of the things that we all forget about is that time is muscle. So the longer that your heart goes without the oxygen to that part of the organ, the more damage it does. So were there any repercussions with his blood flow being blocked for that short period of time?
Very, very minimal. Every time there's a heart attack, there is some degree of heart muscle damage.
Yeah.
Some of it is temporary.
Yeah.
And some of it, unfortunately, at times is permanent. Roger did fairly well. The pumping strength of his heart was almost preserved. And I'm optimistic that in the future, the portion of the heart muscle that wasn't beating as well as it's supposed to may actually improve.
Okay, good. So let's talk about how he was. So throughout the procedure, he didn't have any complications. He managed it well and he went to the ICU. So what happens after that? The ICU is the intensive care unit.
Correct, yes. So after the procedure, as a routine, patients are transferred to the intensive care unit for monitoring.
Right.
And that's usually for the first 24 hours after the procedure. And we're just keeping a very close eye and making sure there are no procedural issues or anything of that nature. And also making sure that he's well taken care of, because a heart attack is as serious as
Of
it
course,
gets.
yeah.
Yes. So we keep him under observation for the first 24 hours in ICU, following which, if everything looks good, he can be transferred out to the ward and then usually another 24 to 72 hours in the hospital, depending on how much heart muscle damage there was and so forth.
Okay. And also how well he responds to the treatment. Right?
Absolutely.
So what are the common post-procedure complications that you see? Now, luckily, Roger didn't have any, but we should touch on what can be seen, right?
So short-term complications, as in shortly after the procedure, the major things that we're looking out for are issues with the access site. So we do most of our procedures from the wrist or the radial artery, and that has a much lower complication rate than the femoral artery in the leg.
Yeah.
So thankfully, we don't see many blood vessel and bleeding complications anymore because of use of the radial artery primarily. We're also looking out for something called stent thrombosis, which is actually formation of a blood clot on the stent. That is quite rare these days with the current medications that we're using, especially in the hospital now where we have people on potent blood thinners and we're monitoring them to make sure that they're taking their medications and so forth. That becomes more of an issue once patients are discharged.
Yes, and let them go home and they don't follow up with their medication properly.
Correct, yes. So prematurely discontinuing the medications, particularly what we call antiplatelet medications or blood thinners as we think of them. Prematurely stopping those medications puts you at a very high risk of forming a blood clot on that newly implanted stent. And essentially, that's a whole another heart attack.
Yeah. So most people get to be on aspirin for life, right?
Aspirin usually lifelong.
Yeah. But they use other medications as well. Which what are your preferences for antiplatelet therapy?
So we use ticagrelor, which is another blood thinner in addition to the aspirin. And that's what we primarily use these days for heart attacks. And that's a twice-a-day medication, and it's continued usually for 9 to 12 months post-stenting in the case of a heart attack.
Yeah. And so it's really important that people know not to stop it.
Absolutely, yes. That's one of the things that we mention to them at every post-procedure visit. We need to make sure that you're faithful with the medications and that prematurely stopping these medications could be life-threatening.
Right.
And hopefully they comply.
After the break, we're going to talk to you about how Roger's progress has been after he was discharged from Medical Associates. And we'll also touch on long-term prevention for heart attacks. So don't go anywhere. We'll be right back.
I was diagnosed with colon and liver cancer. Hearing the news, I was devastated. Having to go overseas, that could be stress and away from your family. Medical Associates, there was no other place to go, and I'm glad that I did because they made my journey even better. I'm more comfortable. They made me part of the family. So besides my immediate family, I now have another family here. I was asking about the cost, and she was like, don't worry, we could organize. So that was a burden taken off of my shoulder. It was like a personalized thing. It wasn't just like the cost, because I've heard that it's so expensive to do this, but they treat you as an individual. I would like to thank Dr. Raghunanan, the office manager here, the nurse in particular who is here with me during the chemo, and Dr. Bim. And also Dr. Solomon, because he was the one that did the colonoscopy, but they made me feel comfortable. I would recommend Medical Associates because number one, the care that you receive. They make you feel comfortable and being part of a family besides your family. Cost is not that matter. What matters is to get you better. So I'm glad that I have this option here, and many other people will also have this option here if it is that they just do the research. For everyone who is going through this, don't lose hope, keep the faith, and know that once you have a positive mindset, you can get through this. Together with the medical staff, together with your family, it can be done.
Welcome back to Medical Associates Health Check. So we're going to tell you about how Roger's progress was. Dr. Ali, take it away.
Yes, Roger has done really well. I actually saw him in the office a few days ago.
Oh, great.
Yes, and the pumping strength of the heart is back to normal, as we were hoping, as we had talked about earlier.
So you determine that, sorry, with an echocardiogram?
Correct.
And your echocardiogram is done post-procedure while he's still in hospital?
Yes. So his first echocardiogram would be done in the hospital before discharge. And then usually at about 6 weeks after the procedure, I would repeat another echocardiogram to see how the heart has improved.
Okay, great. So his pumping strength is almost back to normal, you
Yeah,
said?
essentially back to normal.
Okay, well, that's really good. So minimal damage was done to the heart.
Minimal damage, and that's the importance of getting in there early
Yeah.
and opening up the artery early, because that's how you minimize the heart muscle damage.
So that's not just with, the doctor getting to the procedure and doing it in a timely manner. That also relates to somebody that's experiencing chest pain. Don't wait, come straight in, let us do the necessary tests and figure out what is going on.
Absolutely, yeah. So we always counsel patients to never ignore chest pain,
Right.
even if it's just to get you to an urgent care facility. If there's no emergency room nearby, get an ECG, see what's happening. And if there is an emergent situation, get you to a hospital, to a center that has the ability to do an emergency cardiac catheterization procedure,
Yeah.
because that is the best treatment available
Around the world, that's the gold standard.
worldwide.
And we are happy that we have it to offer in Trinidad and Tobago.
Absolutely.
Especially because heart disease is so prevalent in this country.
It is. It really is.
And one of the things is we should look at how best long-term prevention can be for these patients.
Right. So there are some things that we can do to help prevent future events. Of course, we not in control of the fact that we're all getting older.
No.
And you can't change your gender.
Right. So that, I think that's the thing. Most people don't know that men are at higher risk after a certain age. I think it's 55.
Correct.
At higher risk of developing a heart attack than women are.
Correct.
So yes, you're right. You can't change your gender.
So those are non-modifiable risk factors. What we can modify, obviously, things like cigarette smoking.
Yeah.
So if your patient is a smoker, we counsel them extensively about stopping smoking. Control of risk factors. So diabetes,
Manage it
high
appropriately.
blood pressure, high
Yeah.
cholesterol, making sure that your A1C is at target for diabetes, making sure your blood pressure is immaculately controlled, making sure your cholesterol is up to mark for the most recent guidelines. So all of these things are crucial going forward.
It's interesting you say that, especially with blood pressure, because I could be wrong, but the Trini way is like, I will take medication today, my blood pressure good, so I don't need to take it tomorrow. 3 days later, my blood pressure high, so I took my medication. And that seems to be the pattern, but trying to get our patients to understand that they have to take their medication every day so that you stay at the correct level throughout and you're not jumping here, there, and everywhere. I don't know if you see it in your clinic.
Absolutely. That's always a challenge with hypertension management.
Yeah.
Because the sense is, well, oh, my blood pressure is normal, so no need to take my medication, or I'm scared to take my medication because it's going to drop my blood pressure too
Right.
low.
That's another thing, definitely.
So yes, that is a huge part of education that I do several times a day in my office with all of my patients, encouraging them that even if you check your blood pressure and it's normal, you still need to take your medication, because the goal is to keep your blood pressure normal all the time,
Yeah.
not to have these spikes and dips. Oh, my blood pressure is high today, let me take a tablet. Tomorrow it's normal, I won't take a tablet. The following day it's high. So we're trying to avoid that. What we want to see is the blood pressure being normal all the time.
On the other side of that, I also see patients that take their medication regularly. Doc, I take my medication all the time. I don't know why my pressure is high. And really, you find that they've never checked their blood pressure. In about 3 months, they take their medication routinely and not check their blood pressure to realize that they are now refractory to the medication that they're taking.
Yeah, absolutely. So the home blood pressure monitoring is crucial.
Yes.
And
sugar too. Both of them.
and sugar as
Yeah.
well. But the home blood pressure monitoring is absolutely crucial. There are hypertension clinics around the world where
course.
they don't check your blood pressure when you come into the office. If you don't walk with your blood pressure readings and your logs at home, they tell you, well, go back home, check your blood pressures, and come back when you have your readings.
Yeah.
Because just a one-off reading in the office is often inaccurate.
You're right.
And it's often an overestimation or sometimes an underestimation of what the patient's real blood pressure is.
Correct.
And we're not going to know that unless that patient is checking their blood pressures at home using a standardized technique and brings their blood pressure logs to their office visits.
Perfect. So just to recap, what we need to do is make sure that our patients are properly taking their medication, they are looking at their risk factors to modify them as much as possible. And once you have chest pain, don't wait. Come straight back into any kind of facility, any healthcare facility.
Absolutely.
Just-
Get evaluated.
Yeah, get checked, make sure everything is okay. So that's pretty much all we have time for today. I'm sorry. I'm sure we could have gone on and on about this topic.
No, that's okay. I'm happy to be here.
So don't forget, if you're experiencing symptoms of chest pain, shortness of breath, dizziness, or any of the above, come and see us at Medical Associates. Our emergency room is open at any time. Or go and see a doctor. Make sure you get checked out. Just before we go today, Roger agreed to do a short little stint about how his experience was. So take a look and we'll see you again next time.
I didn't think it was a heart attack. I thought might have been indigestion, maybe a little pressure, something that would have passed, but it didn't. By the time I got to the Medical Associates ER, I was scared. I wouldn't deny that I wasn't. But from the moment I walked in, they knew exactly what to do. There was no confusion, no waiting around. The ER team moved very quickly. Meds, monitoring, tests, everything moved like clockwork. They conducted the angiogram, and the angioplasty process was a lot easier than I thought it would be. All I was left with was a little discomfort in my wrist, where they had to put the needle through. But other than that, the blockages were rectified, and I'm alive today. Medical Associates, due to their response, has me where I am. I'm alive, I'm well. I'm currently awaiting the specialists to understand what's going to happen next.